Hi everyone. Thank you for joining me on Tuesday's Facebook Live series here at DeWitt Physical Therapy and Wellness. And today we are going to talk about how to perform self-massage using a tennis ball. I am Dr. Jeanette DeWitt. I'm a physical therapist, a certified athletic trainer, and a fitness coach. And one of the first things we want to look at today is what happens to your body when self-massage is applied. And what happens to your body when self-massage is applied is very similar to the therapeutic benefits of massage therapy. What you're going to get is an enhanced energy level before physical activity. So you can actually reduce muscle tension and muscle spasming and muscle tightness to help give you more energy before a workout. You may also facilitate some relaxation. All of the things I just mentioned is you're reducing tension, you're reducing some spasming, you may even reduce trigger points, and all of this can help your muscles relax and give you a sense of relaxation as well. Anytime you do a type of massage to your body, you are going to increase blood flow to that area. So you're going to have better circulation in that area. I like to use the example of if your muscles are all knotted up and you bring self-massage to that area, which increases blood flow, that's a natural warming to the tension, to the tissues, and then that tissue can start to lengthen back out and return to its normal length. Before it's all balled up and tense and tight. But afterwards, after receiving either self-massage or therapeutic massage, or what we do in our office is called precision neuromuscular therapy, that ball of tension starts to melt away and the tissue is relaxed and the muscles are relaxed and you feel a lot better and you feel looser. And that can be energizing as well as relaxing. Because you're reducing some of that tension, self-massage techniques as well as therapeutic massage can help restore natural flexibility and improve your flexibility. The other thing is if you have some tendinosis type issues or tendinitis. Tendinitis is an inflamed area, so sometimes using a self-massage technique can be pretty painful. But what you can do is you can break up scar tissue in that area so that you aren't restricted in that tendon attachment, and then that can also help relieve pain and improve mobility of the tendon where it's attaching on to the bone. So regardless of whether it's tendinosis or tendinitis, you can do some self-massage to an area. You just have to be careful that you're not increasing your level of pain to the point where it gets more inflamed. Now, what are some indications for using self-massage? Meaning, why would you want to perform self-massage? Well, we kind of already talked about this a bit. We want to increase circulation. We want to reduce pain. We want to reduce muscle tension. We want to reduce muscle tightness. And we can also reduce muscle spasm. These are all reasons for self-massage. Now, why would you not want to do self-massage? This is key. Here's when you do not want to do self-massage and you maybe don't even want to receive massage. If you have an acute sprain or strain in the area and there's inflammation present and there's a bunch of swelling, you don't want to do self techniques. There are some massage techniques that can help push out fluid so you can receive massage, but you want to do that with a licensed professional. You don't want to take that responsibility on yourself and do further harm. The other thing is if you have an open wound or a diseased condition like cancer, you do not want to do self-massage or receive massage therapy until you've been cleared by an oncologist or a skin specialist. The reason being is if you have a disease condition like cancer or you have an open wound, you do not want to increase circulation in that area because that can increase your risk of spreading an infection or increase your risk of actually getting an infection. So make sure if you have an open wound or you've been diagnosed with cancer that you consult a physician and a healthcare provider to make sure that you're cleared to do either self-massage or receive a therapeutic massage. In an area where there's a healing fracture, you do not want to do self-massage or receive a therapeutic massage. That area is unstable because the bone is healing. So you do not want to apply pressure to that area either with a tennis ball, with your hands, or with some other type of tool. If you have areas that are hypersensitive to touch, you may not want to do self-massage or receive a therapeutic massage. These areas maybe have compromised sensation, or they may be hypersensitive, and the pressure can actually make that area more sensitive and more painful. My rule of thumb is if you have an area that is hypersensitive and you aren't able to notice a difference in that symptom, those hypersensitivity coming down or reducing, if that persists for 7 to 10 days, you need to seek a medical provider like myself as a physical therapist to get a consultation to find out what's actually really going on. It's one thing to have muscle tension. It's another thing to have pain that's lasting for 7 to 10 days. You don't want to do self-massage to that area. You want to find out what the root cause of the problem is. The other thing is if you have arteriosclerosis, you do not want to perform self-massage. And if you have a known embolism, meaning you've had a blood clot and you're being monitored for a blood clot, you do not want to do self-massage because you can move that blood clot. You also do not want to receive a massage because of the same reasons. So arteriosclerosis, or you have been diagnosed with a known embolism, you do not want to perform self-massage on yourself or receive a massage. So these are the reasons why not to. Now, again, let's go ahead back. If you have muscle tension, so I'm going to use the office worker who's at a computer a lot and gets a lot of muscle tension in through the neck between the shoulder blade area and tends to be hunched forward with their shoulders elevated. A self-tennis ball massage is a perfect way to help get those muscles to relax and reduce tension. All you need is a wall or a back of a door and a tennis ball. You're simply going to place the tennis ball behind you and you're going to lean against it. Now, I caution you on this. You don't want to press really hard. I usually like to say if your pain in an area is more than a 4 out of 10, with 0 being no pain and 10 being emergency pain. A 4 out of 10 is as high as you want to go with your pressure of your back onto that tennis ball. And what you're going to do is just gently kind of roll along that ball and work out the tension area. You can release that ball and move it to the other side and do the same thing on that side, on the opposite side. This is a great way to relieve tension. It's also a great way to get a computer break. Now, sometimes I recommend when people are starting learning that technique is put the ball in a tube sock or a long sock. Then you strap the sock over and the ball won't keep dropping on the floor. Depending on the surface of your wall, if it's textured, it will be less likely to slip, versus the back of a door is sometimes pretty slippery, and so the ball will more likely want to drop. Now you can place the ball right between the shoulder blades on the side of the spine. You do not want to put the ball anywhere near a bony area. And you can actually do a little mini squat and write the number 1 parallel to your spine. And this is how you get the muscles between your shoulder blades. And I'm just moving the ball to the other side and doing a little bit of a mini squat against the tennis ball on the wall. So that takes care of some muscle tension into the neck and between the shoulder blade area, but you can also use this for the forearm. I'll roll my sleeve up here, and this is a great one to do if you use the computer a lot. You can put this right along these forearm muscles and just glide the ball up and down. You can do a circular motion. Just like that. And it takes maybe a minute or two to do this, and you'll loosen up the muscles of the forearm from typing on a keyboard. I'm going to lower my camera a little bit just so I can show you. Whoops, falling over here. So the tennis ball on the thigh, the front of the thigh, is also great because you can roll that tennis ball forward and back or up and down. And it's a great way to get a self-massage into your thigh. So if you're sitting in a chair, you can do that as well, or you can I have propped my leg up onto a table to do that. But you could easily do that sitting in a chair. So if you're a runner and you work at a desk, the next day after a long run or a heavy, hard workout, you can take a tennis ball with you to work and just massage your quads, especially if you've done a lot of downhill running the day before. So little tips on using the tennis ball. This works also very well with plantar fasciitis, rolling a tennis ball under the arch of your foot, from the ball of your foot to the heel of your foot. It's a great way to massage and self-massage the arch muscles. So there you have it. You have 4 different areas that you can work on with a tennis ball, and this is a great resource for reducing muscle tension and creating muscle relaxation. I hope that helps you. If you have any questions, as always, you can contact me at 262-842-2220, or you can just email me directly at Jeanette@DeWittPTWellness.com. I will encourage you to visit our website. We have some different events coming up, as well as some different promotions coming up in the month of October, where we are celebrating National Physical Therapy Month. So I encourage you to check out our website at www.DeWittPTWellness.com. Have a wonderful day and enjoy this beautiful fall weather. Thank you.